Okay, we'll move on to the next word. Ready? Antibacterial, a very common medical term. How do you write antibacterial? I write anti, A-N-T-I, as a prefix, A-N-T with an asterisk. What do you do for yours? So then I write bacterial, B-A-K-T, with an asterisk. Antibacteria, I would just write ant-bac with an asterisk. Both strokes have an asterisk. I suggested maybe AEBL as an antibacterial brief. I don't know, maybe use that for something else. Think about it. What would you like to write for antibacterial? Otherwise, you could be writing 4 strokes. That's a lot for one word. What will you do? Okay, have you come up with something? Let's use it. Ready? You don't need antibacterial or antiseptic soap to remove COVID-19 from your skin. Did you use your COVID-19 brief? I hope so. Let me read that again. You don't need antibacterial or antiseptic soap to remove COVID-19 from your skin. Regular soap is great, and in my house, we use plain old Palmolive and Dove bar soaps to wash our hands. Now, if you're not writing real time, but this is going really fast, what would you have done for Palmolive? Palmolive. Maybe just Pamiv. How about putting that in our dictionary? Palmolive. Imagine it might come up if we're talking about soap. Let me read that sentence again. Ready? You don't need antibacterial or antiseptic soap to remove COVID-19 from your skin. Regular soap is great. In my house, we use plain old Palmolive and Dove bar soaps to wash our hands. Antiseptic, another great word. Probably should have that on here. I don't believe it is yet. Let's put it on here. Antiseptic. What can we do for antiseptic? I hope you have 1 stroke for anti because it's a common prefix in the medical field, in other fields too, right? So have a stroke for anti because it's going to come up. Septic, 2 strokes. Could you do S-P-I-K, spic, it's for septic. S-P-I-T with an asterisk for septic, spit. What will you do for antiseptic? If you're not a briefer, could you just make it 2 strokes? Anti for 1, septic for another. Antisep with an asterisk. 3 strokes? Seems like a lot. What are you going to do? Okay, let's move on to antibiotic. Antibiotic would be a great 1-stroke word because it comes up a ton of times, right? We've probably heard it over and over and over. I know for a long time I wrote it as 2 strokes, my anti, and then I would write bite with an asterisk. But now I'm just writing bic, antibiotic, bic with an asterisk. How will you write it? Antibiotic. Antibiotic. Okay, let's read a sentence and use your new brief. Ready? Antibiotic resistance will be a problem with COVID-19. When it weakens the body, it's easier for hard to treat bacteria to take hold. So now we need brief for bacteria, right? I talked about it for a second 2 minutes ago. How do you write bacteria? Not a good idea to make it 3 strokes. Bacteria, maybe 2, but it's going to come up a ton. Just like the word virus. Virus is 2 strokes. Does not need to be. Let's come up with something easy that comes to you right away for bacteria. Ready? I'm going to read the sentence again. We've got antibiotic, COVID-19, and bacteria. Briefs, right? Okay, antibiotic resistance will be a problem with COVID-19. When it weakens the body, it's easier for hard-to-treat bacteria to take hold. One more time, ready? Antibiotic resistance will be a problem with COVID-19. When it weakens the body, it's easier for hard-to-treat bacteria to take hold. All right, we're almost done. Are we done? A. Oh, yes, sorry. Third page, we're almost done. Third away, 2/3 of the way, 1/3 to go. Okay, antimicrobial. 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 3 strokes? Ooh. I know, it's hard. How about just AM with an asterisk? I don't know, maybe that's too short. How about anti-mic? 2 strokes. How about anti-mibol? Anti-mibol. What if we just do mibol? M, long I, BL, with an asterisk. I'm a big one for asterisks. You can tell, can't you? So, antimicrobial, how are you going to write it? Let's make a decision. Antimicrobial. I'll read you a little bit. Let's practice it. Ready? Covalon, an advanced medical technologies company, announces today its new breakthrough antimicrobial technology formulated to kill the COVID-19 virus, or SARS-CoV-2, and other viruses, bacteria, and pathogens. I'll read that again. An advanced medical technologies company announces today its new breakthrough antimicrobial technology formulated to kill the COVID-19 virus, or SARS-CoV-2, and other viruses, bacteria, and pathogens. One more time. An advanced medical technologies company announces today its new breakthrough antimicrobial technology formulated to kill the COVID-19 virus, SARS-CoV-2, and other viruses, bacteria, and pathogens. If you need to work on that word, go ahead and pause and do it. Take your time. Okay, I'll read some more. The new technology, called CovaGuard, has been specifically formulated to be effective at killing pathogens like the COVID-19 virus on contact, with the added benefit of providing persistent protection by trapping and deactivating microbes over an extended period of time. Let's pause. Maybe there's some words there you want to put in your dictionary. CovaGuard. Ready? Based on testing to date, the CovaGuard technology has demonstrated sustained activity of up to 4 days. The CovaGuard technology is designed to be safely applied on skin as well as protective medical equipment like masks and gloves, whether used for the first time or reused. Okay, I'm going to go back and start where we started 2 minutes ago. Ready? An advanced medical technologies company announces today its new breakthrough antimicrobial technology formulated to kill the COVID-19 virus, SARS-CoV-2, and other viruses, bacteria, and pathogens. The new technology, called CovaGuard, has been specifically formulated to be effective at killing pathogens like the COVID-19 virus on contact, with the added benefit of providing persistent protection by trapping and deactivating microbes over an extended period of time. Based on testing to date, the COVIDGuard technology has demonstrated sustained activity of up to 4 days. The COVIDGuard technology is designed to be safely applied on skin, as well as protective medical equipment like masks and gloves, whether used for the first time or reused. All right, let's move on. Next word, antiretroviral. A lot of strokes there. You can write viral in one stroke, V long I, R, L, anti-ret-viral. How about just AR with an asterisk? Is that anything else for you? Antiretroviral. Antiretroviral, lots of strokes. How are you going to write it? Let's write it again, antiretroviral. How about just anti-ret? If you're not a big one to squish all of that into one word. A-N-T with an asterisk, R-E-T with an asterisk probably. Ret might be for something else. I certainly wouldn't write out antiretroviral. That's a lot of strokes. How are you going to write antiretroviral? So here's how it comes up. I'm going to go ahead and read. Ready? People living with HIV and on effective antiretroviral treatment, ART, are currently not at an increased risk of getting coronavirus or developing severe symptoms. People living with HIV not on treatment or virally suppressed may be at a greater risk. Speak to a healthcare professional for more information on how to stay healthy. So we had HIV come up. That comes up a lot, just in general, in medical terms sometimes. Are you writing HIV in one stroke? How about H long IV or HIV with an asterisk? HIV, HIV. Antiretroviral came up, as we know. ART as a acronym came up. You could write it as ART with an asterisk. Put it in your dictionary. What do you think? Coronavirus came up. We have our stroke for coronavirus, right? I mean, our brief. Okay, I'm going to read it one more time. Ready? Oh, one more word. Symptoms. Common word. I do SIMS with an asterisk. How about you? Hopefully not 2 strokes. Come on, let's make it 1. Ready? Here we go. People living with HIV and on effective antiretroviral treatment, ART, are currently not at an increased risk of getting coronavirus or developing severe symptoms. People living with HIV not on treatment or virally suppressed may be at a greater risk. Speak to a healthcare professional for more information on how to stay healthy. Do you have 1 stroke for information? I hope so. How about N, F, BGS? That's how I stroke information. How about you? Okay, a few more words here. Antiviral. Of course that's going to come up, right? Do you have your stroke for anti? You have your stroke for viral, 2 strokes. Or how about AEFL with an asterisk? Antiviral. How will you write that word? Okay, you ready? Remdesivir is an investigational intravenous drug with broad antiviral activity. I'm not sure if I'm saying that drug correctly. Remdesivir. Remdesivir. Do you want to put that in your dictionary? Might come up. Let's use this time to work on our dictionary. Ready? Remdesivir. Remdesivir. Remvar? Remdesivir. Remdesivir. Okay, here we go. Remdesivir is an investigational intravenous drug. How about intravenous? Intra? One stroke, prefix. SPWRA. Intravenous. One stroke, two strokes. Remdesivir is an investigational intravenous drug with broad antiviral activity that inhibits viral replication through premature termination of RNA transcription and has in vitro activity against SARS-CoV-2 and in vitro and in vivo activity against related beta coronaviruses. Lots of words in there. So, how are you going to handle those? Do you have strokes for in vitro? Is it an easy stroke to write it in 3 strokes? In vitro, in vitro, in vivo, in vivo, or just in vive, in vite, if you don't want to make it 1 stroke. Okay. Remdesivir is an investigational intravenous drug with broad antiviral activity that inhibits viral replication through premature termination of RNA transcription and has in vitro activity against SARS-CoV-2 and in vitro and in vivo activity against related beta coronaviruses. That was a mouthful. Okay, we'll go on to the next word, which is assess. 1 stroke, 2, how about 1? How about the stroke SES with an asterisk? Assess. How will you write it? Assess. We need to assess the information before we move on. Please assess the information before we move on. Will you assess the information before we move on? Simple word. Why do it 2 strokes? Assess. How about assessment? Can we make it 1 stroke? As you can see, I suggested SMT with an asterisk. What also comes to mind is SEMT with an asterisk, assessment, SEMT with an asterisk. How about just assessment if you have to do 2 strokes instead of 3? Okay, what are you going to do? Okay, let me read for you. Ready? The assessment of the information was correct. What will be your assessment of these terms? Can you assess the information before the assessment by your employer? What is your assessment of all that is going on in our world right now? Will you assess it positively or negatively? What is your assessment? Please assess the information before we move on. Okay, next word, asymptomatic. Symptom, symptomatic, asymptomatic, 3 different words will come up a lot. Symptom, 1 stroke. What's your stroke? Symptom. Symptomatic. Asymptomatic. You can see my suggestions there on the sheet. How about just AIM with an asterisk, long A, M with an asterisk for asymptomatic. Maybe a long A, MS, asymptomatic. How about AEMS? What do you like to do? Let's come up with something. Ready? Let's use it. Put it in our dictionary. Asymptomatic. Here we go. After 3 days of coming into contact with her aunt with the diagnosis of COVID-19, the patient appeared asymptomatic until the 4th day when she started to cough. Were your symptoms asymptomatic for the first 10 days or 2 weeks? The patient was asymptomatic before she saw the doctor. The patient was asymptomatic, sought medical treatment, decided to go to the emergency room. What were your symptoms before you started treatment? Were you asymptomatic for a long time or a short time? Your symptoms were important to report to your doctor so she could assess your diagnosis. Her assessment of your condition, although you were asymptomatic with no symptoms, was that you had COVID-19. Lots of use there for those briefs. Okay, 3 more words and we're done. Ready? Avian. Avian. A-V-I-A-N. Avian. After the avian flu, the state invested over $200 million into a mobile hospital program. Avian. A-V-I-A-N. Long A, and then the word veen. Or how about just the word veen? Avian. Veen with an asterisk. How are you going to write that word? Let's put it in your dictionary. Avian. All right, I'll read some more. Ready? The avian flu, the state invested over $200 million into the mobile hospital program and a related initiative to stockpile medicines and medical gear for use in infectious disease outbreaks. One more time. After the avian flu, the state invested over $200 million into a mobile hospital program. After the avian flu, the state invested over $200 million into a mobile hospital program and a related initiative to stockpile medicines and medical gear for use in infectious disease outbreaks. Infectious disease. I hope we have one stroke for disease. Do we? Let's come up with one. That's a word that will come up a zillion times in our lifetime. Okay, disease. What are you going to use? I use DIS with an asterisk. Okay. Bacteria. What are you going to use for bacteria? Next word. I mentioned earlier I use BAK with an asterisk, but I actually might use BAEK, which is here on my sheet, and I believe that is what I do because I use BAK as a suffix, like callback. Okay, bacteria. What are you going to use? Put it in your dictionary. The bacteria we find on our hands after cleaning a rat's den can be deadly. What bacteria are on your hands after you've gone to the grocery store? There is much bacteria in our bathroom if we don't clean it often. Bacteria can cause infection and disease. The bacteria we find on our hands after cleaning a rat's den can be deadly. Okay, bacterial. Of course, that's going to come up, like bacterial infection. What will you write for bacterial? Adding the IAL to maybe your backstroke. Well, I added a T because you can't really add the L, right? If you're using the BG for bacterial, the K sound. Okay, did you come up with something? All right. Ready? Let me read a sentence. That bacterial infection was serious. The COVID-19 virus has caused you to get a bacterial infection in your lungs. What will your doctor treat you for if you have a bacterial infection? Will it be the same as you would be treated for COVID-19 virus? Probably not. What antibiotic will your doctor use for your bacterial infection? Will she use an antiviral? Like remdesivir? Will she assess you before giving you an antibiotic? for your bacterial infection. Do you suppose after the avian flu, the doctors decided to treat everybody as if they had a bacterial infection? Or did they treat everybody as if they had an antiviral disease? Oh gosh, I'm just making stuff up. Here we go. Keep going. Remdesivir is an investigational intravenous drug with broad antiviral activity. There will be many bacteria fighting agents that we will use to combat COVID-19 virus. We will use antimicrobial medications, antiretroviral medications, and many intravenous drug applications for antiviral activity against the SARS-CoV-2 that has hit our nation. I'm going to go back to the beginning and just read the words. Let's see how you do just using your briefs. Ready? COVID-19, ADAR, ADAR. Remember, it stands for adenosine deaminase, RNA specific, ADAR or ADAR. How about just ARDS, ARDS? Stands for acute respiratory distress syndrome. Acute respiratory distress syndrome. How about her symptoms were acute for 4 days? Adenine. Adenine is an organic compound. Adenosine. Adenosine. Adenosine plays an important role in energy transfer as adenosine triphosphate and adenosine diphosphate. Adenovirus. Severe acute respiratory syndrome, coronavirus, SARS-CoV, emerged in 2002. Alex Azar. Secretary Azar. Alveolus. Alveoli. Alveolus is plural and is a word used in anatomy for hollow cavities. Animal to human SARS-CoV-2 transmission. Animal to human SARS-CoV-2 transmission. Antibacterial. Antibiotic. Antimicrobial. Antiretroviral. Antiviral. Assess. Assessment. Asymptomatic. Symptom. Avian. Bacterial. Bacteria. Bacterial. Bacteria. That's it for this video. Thanks for joining me. I appreciate it. I hope you've learned something. I hope you have added lots of words to your dictionary today. Bye-bye.